let's talk about suicide and NPD and narcissism.
Yeah. Well, there are some specific things with suicidality in people with pathological narcissism or NPD, namely that, first of all, they can have suicidal preoccupations. It comes in specific situations or that is more consistently there, that can actually paradoxically help them stay alive, because they have a sense that, okay, if something happens, I can end my life. I can be in control. And if that doesn't happen, then
they can control the narrative. I mean, they can control the way out.
And that has to do with life-sustaining suicidal ideations.
Do you, out of curiosity, if someone has life-sustaining suicidal ideations, do you not try to stop that because it's keeping them alive?
Well, if it is so, then it's a matter of sorting out whether there are other ways to take charge of life.
I see.
But not condemn or dismiss them. But actually see that they do want to stay alive, but there are certain things that makes them afraid of being alive. But that is one thing. The other thing has to do with the hypersensitivity to extremely challenging situations that can escalate acute suicidality with lethal intents. And those types of suicidal patterns can be very difficult to deal with because the person holds them to themselves and can both be suicidal, having faced a very difficult situation, but at the same time be very systematic in planning. And NPD has actually been associated with higher lethality in suicidal actions.
Right.
They plan it and execute it in a way that leads to end of life. Borderline makes suicide attempts.
Right.
Narcissistically related suicide usually has to do with very challenging life experiences and situations where the person can't see an opening or a possibility.
Right. And if you're treating someone who you think is sort of a narcissistically inclined person, an NPD, have you had ways to divine when you've worked with someone that might be going on, or is it that you're always...
Well, it's a matter of having the patient begin to talk about it from their own perspective. And one way of open up that, I often say that it's not uncommon in a situation you are in that suicidal thoughts starts to come to one's mind. And some people then say, yeah, I know that's what I'm struggling with. Other people say, no, I'm not. And then you have put it on the table, and then some people then who said no at that point, a few weeks later or the next year can come and say, yes, I talked about it all the time, but I didn't want to tell you because I didn't want to have consequences. And so it varies.